I'm a union steward and I chair the insurance committee for our local lodge. I understand the company's telling our negotiators that our members are satisfied with this insurance, that they're not hearing any different, and I'm here to tell you that if they're not hearing, they're not listening. I hear complaints constantly. People are not getting the treatment they need because they can't afford the co-pays. They need, let's say the doctor tells them to go for physical therapy. Well, they got to pay $20 every time they go to physical therapy, so they're going 2 or 3 times a week. You add $60 a week. Most people can't afford an extra $60 a week to go for physical therapy, so they're just skipping it. They're going without. They're doing without their medications because they're not covered under our insurance. Maybe it's a $40 copay, and maybe that our insurance won't cover it all. So they're just doing without. Our people are going without the coverage they need, the medication they need, the treatments they need, the tests they need, because they can't afford it. They go in and pay a $20 copay to for a doctor's visit, and then they have to pay an extra $100 for blood tests, urine tests, those kind of things. So they're skipping them. They're not getting their PSA test to see if they have prostate cancer. They're not getting blood tests for cholesterol, for diabetes, things that they need to be checked for. They're not going and getting checked because they can't afford it. They are not getting the coverage they need. They're not happy with it. If the company doesn't see that, it's because they don't want to see it. These people are doing without coverage. They're complaining to me. I'm passing those along, but the fact is that all I can work with is what we have in the policy. And this policy is so lame compared to what we had in the past. People are used to going to the doctor and paying a $10 or $20 copay and having everything covered. Now it's not. The first couple $100 is out of your pocket for all the blood tests, all those things. People just can't afford it. So many people are doing without the treatment they need, or going to the point where they have a heart attack before they go to the doctor and get checked because they can't afford it. They don't want to spend the money. They're afraid to spend the money. Well, maybe it'll pass, rather than spend $60 or $100 to have tests run that maybe they don't need. But they're winding up in the hospital. They're winding up having bigger bills, more expensive bills, putting a lot more bills on our insurance because they pass the test, because they don't go get the test because it's going to cost them money.
The insurance is just too high. And I think we should all have the choice to pick wherever we want to have our hospital care taken care of,
With our preferred, I can go in and have blood work during the year and not pay anything at all other than my copay. The same way with my medications. A lot of my medications under their plan fell in the generic form, to where, like my wife's, a lot of hers are the high-end medications for seizures and stuff like that. Well, you figure if they give you a 30-day supply at $40 and she has 5 medications, then my medication's on top of that. It don't take long for the old cash register to go ring it up. And it's ridiculous that they want to say that this insurance is the best insurance we've had, and it ain't. I've had better insurance at other jobs that paid a lot less than this.
We have some family members that work at Cessna, and their co-insurance is a lot less expensive than ours. Their co-pay on their drug plan is much less expensive. And I think we need to be a little more even. We're in the same kind of business, right? So I think it needs to be a little more even.
But the co-insurance, the copay, we pay that every time we go to the doctor. And then there's other things were added on, we were told was co-insurance that we'd never heard of, which amounted to 1/3 of the total bill. So when you get $2,000-3,000 bill, that co-insurance adds up real quick. And I guess we probably paid between $3,000 and $4,000 out of pocket, besides our co-pays.
People, some people are happy with Wesley, but people want a choice. They want to be able to say, if I'm having a heart attack why can't I go to a heart specialist? Why can't I go to Galatia or Via Christi, who has, I know that Via Christi is a stroke specialist. So if they feel like they're having a stroke, or their doctor feels like they're having a stroke, they would prefer to go to Via Christi. But because they know their insurance only pays for for Wesley, then they're going to Wesley, not getting the special treatment they need, the best treatment they could get, because our insurance doesn't cover it.
I know things go up. Gasoline's one, everything seems to go up, but they'll want to do that, but they won't want to raise the wages. But I don't think, I think we need to try to keep it where it's at, or lower even, so we get good care for a change.
Yeah. The whole idea of this company when I come out here was I was under the understanding that it was a family kind of business that took care of their employees and tried to make it as best it could. And I've never seen any of it in the 10 years I've been out here. They want to work you long hours. They don't care whether, you got plans with a wife and kids. They'd rather make it so that you work 10-hour days, 12-hour days, whatever they want to make their planes go out. And the family does not matter out here.
Well, I'm prepared to strike if necessary, and to me this is a key issue, because I'm not in the best of physical shape, and I've had some troubles in the past, but to me this is a very important issue. More important than some are to other guys, but this is important to me.
I'm willing to strike, because I think we deserve better. People deserve better. And the young people don't understand, like I didn't understand when I was their age. They need to look at their future. And the way things are going, we don't have one.
Well, if they're not going to improve our insurance, our wages, benefits of all sorts, I'm ready to strike right now. If we do not get at least what Cessna gets or better to bring us up to their level, then there's a reason to strike, because we deserve as much as Cessna does.
I think we're getting screwed. I really do.